If you are a federal retiree or annuitant with access to federal employee health benefits, you face some options about which FEHB plan to choose and whether you should enroll in just Part A or both A and B of Medicare. Federal retirees also have the option to suspend their FEHB coverage and enroll in a Medicare Advantage plan through the private market. Although my agency, Boomer Benefits, does not assist Medicare beneficiaries with enrollment into any federal plans, we get questions like these from federal retirees all the time. So I've created a courtesy video to walk you through what we know about your options. I'll also share some resources for federal annuitants and how to find the Office of Personnel Management website to help you do further research after this video. Throughout this video, you'll hear me refer to federal employee health benefits as FEHB. Let's start by covering some of the basics. Federal employees who are enrolled in FEHB are eligible to keep that coverage into their retirement years. The federal government pays approximately 72 to 75% of the premiums for retirees or annuitants, as they are called. There are a variety of FEHB plan options you could choose, including fee-for-service plans, HMO plans, PPO plans, and high-deductible plans. HMO and PPO plans have networks of providers and facilities and therefore usually have lower out-of-pocket costs as you use your benefits. Fee-for-service plans allow you to see any provider, but you may end up paying higher costs for that freedom of access. According to the opm.gov website, plans under the FEHB program help to pay for the same kinds of expenses as Medicare. However, FEHB plans also provide coverage for emergency care outside the U.S., which Medicare does not provide. And Medicare covers some orthopedic and prosthetic devices, durable medical equipment, medical supplies, limited home health care, and limited chiropractic services, which some FEHB plans may not cover or may only partially cover. If you are entitled to Medicare Part A without paying premiums, as most beneficiaries are, you should consider taking it even if you're still working, as it may help cover some costs that FEHB won't, such as deductibles, co-insurance, or other charges that exceed the plan's allowable charges. You can also change your FEHB enrollment in the 30 days prior to becoming eligible for Medicare. It's a one-time enrollment change opportunity. After that, you'll have the annual open season to change your FEHB enrollment if you want to. They offer this because once Medicare becomes your primary payer, you might find a lower cost FEHB plan that's a better fit for you. Some plans waive deductibles, co-insurance, and co-payments when Medicare becomes the primary payer. Also, if you have Medicare and FEHB, you do not need a Medigap plan because FEHB already serves as a sort of wraparound to your Medicare. Here are a few ways that you can structure your benefits once you turn 65 and become eligible for Medicare. Option 1, you can keep your federal employee health benefits as your primary coverage and enroll in Medicare Part A, but not Part B or Part D. This option allows you to keep the FEHB as primary without having to pay any additional premiums for Medicare Part B. Most people qualify for premium-free Medicare Part A because either they or their spouse have paid FICA taxes during their working years, which has now made them paid up for Part A. This means it costs you nothing to add Medicare Part A, and it may help you if you have any inpatient hospital stays. However, if you only enroll in Part A and not Part B, you will pay many of your own FEHB copays out of pocket. So on the one hand, you'll be saving the money that you would have spent on Part B premiums, but on the other hand, you pay your own copays for various healthcare services as you go along. You'll want to weigh the cost of paying monthly Part B premiums against the cost of paying your own copays out of pocket. If you tend to use a lot of medical care, it might make sense to pick up Part B so that it could help you with paying those copays for you as you go along. Also, if you don't enroll in Medicare Part B when you're first eligible, but later you decide you want to add it, you'll be subject to a 10% late penalty for every year that you could have been enrolled in Medicare Part B, but were not. Option 2, keep your FEHB and enroll in both Medicare Parts A and B, with Medicare as your primary coverage and FEHB as your secondary coverage. In this situation, you are paying for Medicare Part B and for FEHB benefits, but the advantage is FEHB may cover the 20% coinsurance that Part B normally doesn't cover, as well as help with your Medicare deductibles and copays. Often the result of having both is that you will ultimately have little out-of-pocket costs as you use your benefits. You would likely not need Medicare Part D since your FEHB plan already includes your drug coverage. So this option provides fuller coverage than the first option, and although you'll be paying premiums for Medicare Part B, that is somewhat offset by the fact that you don't pay 100% of the costs for your federal employee health benefits either. Lastly, if you receive any services that Medicare typically doesn't cover, then your FEHB will likely step in to pay those items for you. Option 3, you can enroll in Medicare Parts A and B as your primary coverage and suspend your FEHB temporarily with the option to re-enroll in it in a future FEHB open season. If you went this route, you would then choose a Medicare Advantage plan so that you have affordable but comprehensive coverage. We often see people do this if they determine that enrolling in this coverage would be less expensive for them than keeping their FEHB active. Advantage plans are very popular today, with more than 50% of Medicare beneficiaries choosing them for their coverage. And also in many urban areas, you can find Medicare Advantage plans with a zero premium, which means you pay nothing for the plan other than what you're already paying for Medicare Part B. These plans offer attractive extras like dental, vision, and hearing benefits, gym memberships, and other items. Unfortunately, my team cannot advise you on your FEHB plan options, but I'm going to leave you with some resources here so that you know where to go for your next steps. Please be aware as well that the information in this video is general, and some of what I've shared here may be subject to change if you happen to be viewing this video in the future. Ultimately, you are responsible for researching your own options for FEHB plans as a federal annuitant. Your best resource will be the opm.gov website for the latest information on plan options and a state-by-state plan information map. You can find details about FEHB plans offered in your state and a handy comparison tool to help you choose. Thanks for watching. If you want to learn more about your options for Medicare Advantage plans, check out this video next.